So now we will move on to the discussion of mitral valve prolapse. So what is this mitral valve prolapse? As the name suggests, there is prolapse of the mitral valve. There is prolapse of the mitral valve. Into what? Into the LA. So what are the other names for this mitral valve prolapse? It is also called as floppy valve syndrome. It is also called as Barlow's disease. Okay. So this is also called as floppy valve syndrome or Barlow's disease. So can you see here in this diagram, can you look at the mitral valve apparatus? So you can see that the mitral valve has a large number of folds. There are a large number of folds, and the mitral valve, if you just take calipers and pull it up, all of these folds can be pulled up. This is because of degeneration. This is because of degeneration, and there is a lot of degeneration of the collagen and replacement by collagen. So there is degeneration of the valve and lot of replacement by collagen, which results in this mitral valve to become very floppy. So the mitral valve becomes very floppy, and when the mitral valve tries to open towards the late systole, the mitral valve basically starts moving into the LA or prolapsing into the LA. So this is basically what we call as your mitral valve prolapse. So what are the conditions associated? Most often mitral valve prolapse is inherited as an autosomal dominant fashion, and they are asymptomatic. So it can be seen as a benign condition, but it can be seen associated with other collagen vascular disorders as well. It can be seen associated with Marfan syndrome. It can be seen associated with Ehlers-Danlos syndrome. Ehlers-Danlos syndrome. Right, so it can be seen associated with collagen vascular disorders like Marfan syndrome and Ehlers-Danlos syndrome. Okay, so what are the clinical features associated with this mitral valve prolapse? So what are the symptoms that they can present with? They can present with non-specific chest pain. They can present with non-specific chest pain. Sometimes they can be associated with palpitations as well. They can be associated with palpitations as well, but most commonly they remain asymptomatic. But most commonly they remain asymptomatic. Okay, so that is about the symptoms of mitral valve prolapse. So let us look at the signs. What are the signs? Whenever there is the opening of the mitral valve, what happens is that the mitral valve prolapses into the LA and the chordae become tightened. Right? The chordae become tightened. Right? So this can be associated with some amount of mitral regurgitation. The blood flows this way, and this can result in a late systolic murmur. This can result in a late systolic murmur. Okay, so this is about the murmur which is seen in mitral valve prolapse. Let us look at the dynamic auscultation. So whenever there is a decreased venous return, so the basic fundamental principle is that when you go through the lectures on the approach to murmurs, whenever there is a decrease in the LV cavity size. So whenever there is a decrease in the LV cavity size, what happens is that the murmur increases. The murmur increases because the prolapse increases. Okay. So those conditions where there is a decreased venous return, which basically means that whenever there is a decreased venous return or a decreased afterload. So what happens to the LV cavity size? The LV cavity size decreases. This is seen in standing as well as Valsalva. So what do you find here? This is nothing but your ejection click, which is associated with the MVP. So the click and the murmur move to the left. The click and the murmur move to the left and the murmur becomes longer. Right? So standing and Valsalva, the MVP murmur increases. Right? So whenever there is an increased venous return or there is an increase in the afterload, such as isometric hand grip or squatting, what happens to the cavity size? The LV cavity size increases. The LV cavity size increases. So the click and murmur move to the right and the murmur decreases. Okay, fine. So this is about the basic pathophysiology and how this mitral valve prolapse is happening. Let us look at the investigations. You see the echo, there will be more than 3 mm of the prolapse of the mitral valve into the left atrium. So that is your mitral valve prolapse. Okay. What is the treatment? There can be palpitations, so the patient can be treated with beta blockers. For mitral regurgitation, generally the patient does not require a replacement, but he may require a surgical valve replacement if it is very severe. What are the complications which the patient of mitral valve prolapse can happen? What are the complications which the patient of mitral valve prolapse can have? He can have infective endocarditis, and so this can be associated with emboli as well. So the patient of mitral valve prolapse can have infective endocarditis and it can be associated with emboli as well. So that is in brief about mitral valve prolapse. Thank you.